Welcome to the Institute of Quarrying webinar, COVID-19 and Health and Hygiene Management. Our presenters for this webinar are Clayton Hill and Kylie Long. Now, Clayton is a director and past president of the IQA and principal of Groundwork Plus. Clayton has over 19 years' experience in the quarry industry in both the public and private sectors. Clayton provides industry-relevant assistance to clients in Australia and overseas, focusing on health and safety, efficiency improvement, acquisition and divestment, market assessments, materials testing and operational advice. Clayton holds a Bachelor of Environmental Technology and a Master's degree in Public Health. Kylie Long is the Senior Safety Consultant at Groundwork Plus and also has over 19 years' experience in workplace health and safety, including in the quarry and mining industry. As a senior safety consultant, Kylie provides industry-relevant assistance to clients focusing on the workplace health and safety matters, including safety systems, audits, risk assessment, and root cause analysis and regulatory advice. Kylie is also a registered nurse and has been working in the Queensland Health Virtual Ward and Emergency Department, looking after positive cases of COVID-19. Kylie holds a Bachelor of Nursing, Master of Health Science, and a Graduate Diploma in Occupational Health and Safety. I'll now hand over to Clayton to get the webinar underway. Thanks, Clayton.
Thank you, Lisa, and welcome to everybody. Thanks for joining us on this webinar. We're very pleased to put this package together on behalf of the Institute of Quarrying Australia for our members and the industry at large, particularly given the current status of the pandemic with COVID-19. So running through the overview today, what we're going to cover in this webinar. We're going to talk about what COVID-19 is. We're going to talk about risk management and business planning, management measures, infection prevention, and resuming work after restrictions, which is very relevant given that some of the states are beginning to lift the restrictions around social distancing and COVID-19 management. And then some further resources for you to look at should you require further information. So, what is COVID-19? COVID-19 is a new or novel strain of coronavirus, which is causing respiratory disease, and we call it COVID-19. Scientists have actually figured out the actual strain of coronavirus, and they've identified that through a number of tests, naming it officially SARS-CoV-2. Now, we obviously know it as COVID-19, and that's being used more for simplicity for those that are diagnosed as positive with the virus. One of the reasons that this webinar is put together is really to help businesses enable to identify and manage the risk associated with that exposure to COVID-19. Businesses should be planning for how they respond to the pandemic and what to do as a business if they have both a positive case, but also how to prepare in case they have a positive case and try and prevent that exposure for their workers. So how to respond to that should obviously be in line with the relevant health departments, and we do have a number of those, of course, across Australia, each having their own individual but similar requirements. So it's worthwhile noting that what might be required in Queensland may not necessarily be the same in South Australia or Western Australia, etc. COVID-19 does spread in a similar way from person to person like the flu, and it's generally done through close contact. You may have heard through the media or through the various health departments, it's generally taken that close contact is around 15 minutes in time where you've been in close contact to another person who's been infected by COVID-19. And it's generally from touching surfaces as well, so you can transmit the disease by doing that, or airborne through sneezing, or coughing from the infected person, and then obviously either touching yourself or inhaling those particles. COVID can cause symptoms very similar to the flu, including fever, cough, sore throat, tiredness, and shortness of breath. But it is worth noting that not all of those symptoms occur together. They can occur in isolation, and many people are actually asymptomatic, so they're not showing symptoms as well. So it's more important for us to consider what those prevention measures are, just not responding to someone who is showing symptoms. So talking about risk management, COVID-19 really is a hazard which should be treated no different to any other workplace hazard. This includes us assessing the risk and documenting the controls that we're using on site in terms of the particular hazard being COVID-19. So management of those risks should be included within your site's safety and health management system. That could take various forms, and I'll talk a little bit more about that in the future slides. The IQA, though, has provided some information sheets and a tool called the COVID-19 Health and Safety Management Plan Assessment Tool to help you go through and assess the types of measures that you might be wanting to put in place and what you have or have not put in place on your site. It's designed to assist quarries with conducting site-specific risk assessments while implementing the government recommendations and procedures regarding COVID-19. Well, I've got some of the slides here from the assessment tool itself. So we'll be going through the detail of some of these sections in the further slides, but I'll just show you what the tool looks like. It can be downloaded from the IQA's website. So we're talking about business and reporting, so about a business continuity plan or response plan for COVID. There's certain measures there within that response plan, certain contents which we would recommend be included. They've then got some items around risk assessment, doing that assessment of that risk of COVID and the measures that we might want to put in place. That's also linked to, again, looking at the updating the safety and health management system and keeping records, those sort of items. We've got some more information there on social distancing and helping you to identify whether you're, I guess, putting best practice into play in terms of that, including signage, making sure we're social distancing or physical distancing with the 1.5 metres away from each other, and looking at some other arrangements like shift rotation and looking at how we're using our amenities and so forth and trying to comply with the physical distancing arrangements. There's some information and checklists there for vehicle and machinery hygiene. Again, we'll go through that in a little bit more detail. And then some health and hygiene practice items there, running through, again, things that need to be considering in terms of cleaning and those sort of nature of things throughout our workplaces. Some items about working from home and travel. Obviously, there's a lot of us working from home at the moment, as I am presenting this webinar. And so there's a little bit around HR as well, and a few other things that maybe you haven't considered when your employees might be working from home versus being in the normal work environment. And then also how we're dealing with customers and the community, so communication and how we're dealing with those that might normally visit our site. So there's some checks there to consider those particular measures. As always, there's some further information there about getting in contact with the Institute, but also the federal government's website, health.gov.au. There's a checklist here around good hygiene practices, what to do if you do develop symptoms, some information around hand washing practice, and cleaning and disinfection. Just some further information there around those items. And then what we've put together is essentially a further information checklist. Again, we've got various states and territories that have different requirements from the health departments. So the IQA has put together, I guess, a few links there that you can access through the assessment tool to get that further information should you need it. Okay, so further in terms of the risk management side, every operation is different, and whether you're an operator, you're a quarry, or whether you're a supplier, everyone's going to have different requirements in terms of their business and the nature of business and their exposure to COVID-19. Some workplaces may be in rural areas and have very little exposure or very little cases, so their risk may actually be lower than those that are in the metropolitan areas, but still it's important for us to go through this assessment process of risk and take those appropriate actions that we need to mitigate that risk of catching COVID-19. We need to be across the government updates. Things are changing really regularly, and there are quite a few states that are beginning to lift the restrictions. And again, we'll talk about coming out the other side of the pandemic. But it's important to stay up to date through both the national COVID information that's provided by the federal government as well as your state health authority. So in terms of business planning, it's important that we do actually have a response plan or a business continuity plan. There are a couple of regulators, particularly I know in South Australia, that have been requesting of quarries this type of information, New South Wales as well. The regulator has been very keen to see how quarries are responding to COVID through a management plan, whether that be your health control plan or a specific plan like a business response plan like we're talking about here. So the sort of things that should be included in that business plan or continuity plan should be when the plan is actually activated. So maybe for your business, it doesn't need to be actually activated until a particular point in time. Maybe, as I said before, maybe the risk is quite low in the area which your business is operating. So you might have some triggers there which say when this plan should come into play. It should include precautionary measures. So as I said earlier on in the webinar, we shouldn't just be responding to when you have a confirmed case, but also putting measures in place to avoid or reduce that risk of actually getting that exposure. Health and hygiene measures that we should be putting into place, they should be documented. And then importantly, how are we going to respond? How are we going to, what are we going to do as a business should we have a confirmed case of COVID-19 and workers are not able to attend our work? So it's not just from a health perspective, but also an influence or an impact on the business itself. We should identify and document how we're going to communicate with our workers and contractors and customers. That should be included in the plan. And measures also should be implemented in the event that we're forced to close. Now, some businesses and the quarrying industry fortunately hasn't been part of those mandatory closures, but some businesses have been forced to close. So, you know, in the event that we were asked to do that, how we deal with that and how we deal with coming out of that and reopening as well. Site contact details and medical facilities should also be included in there should we need to quickly access that information, and provide further information for the business and our workers and further resources should they be required. So that's the sort of content of a business plan or a COVID response plan that we would suggest be looked at. Doing a risk assessment though, this is the next step, I guess, in terms of looking at the impacts there. So a site-based health and safety risk assessment should be undertaken. Now, I mentioned before health control plans and safety and health management systems. It doesn't matter how you really do that. Some regulators would prefer to see it in a particular style or nature, but from our perspective, doing a risk assessment may take a number of forms. You might have a risk register that you run on your site, which then COVID-19 just becomes a hazard which you're dealing with in that risk register. You may choose to actually produce a whole new section in your safety management plan dealing with COVID-19 and those risks. So it's up to you how you respond to that, and up to you depending on which regulatory environment you're in, what the requirements of your regulator are. But at least we should do that assessment and be documenting that. Making sure that we have actually thought about the requirements on our sites, each task that we're doing, identifying points of interaction, potential exposure, and the controls that we need to put in place for that exposure. And again, we'll go through that in a little bit more detail, which was also included in that assessment tool and checklist from the IQA. We should keep a record, a register of all workers and suppliers on site that are there. It's important to know, obviously, if we need to do contact tracing and assist with that process, should we have a positive case of COVID. And also, how are we going to communicate? We need to determine that with our staff and those that work on our site and do that on a regular basis. We're not just doing that once. We need to stay in constant communication. There's a lot of people and workers out there that may be a little bit anxious about the COVID situation and the impact on their position at work. It's important that we do provide that regular information to them about how our businesses are responding and what we're doing, and also what those risks are, how we've identified those, and what the controls we're putting in place. So it's important to stay in contact with our workers in that regard. So in terms of some of these measures that we're talking about, and social distancing will be hopefully not unfamiliar to those that are on the webinar. So it's something that the federal government's obviously requiring and our state health authorities are requiring. So to help with that, we're suggesting that some signage be put in place. And you may have seen that if you've been out to the supermarket, for example, indicating the 1.5 metre distances for lines and so forth. We should have some signage in, particularly those areas where our workers are congregating, to remind them of that need to socially to distance themselves from each other, physically distance. Same thing goes for inside offices and administration buildings, making sure that our workstations are at least 1.5 metres away from each other. Workers are not facing towards each other, so that risk of exposure is reduced. We could install physical barriers, such such as on the weighbridge, and you've probably seen that again out if you've been to the supermarket in terms of the checkout operators, those sort of things. So that physical barrier assists also in terms of preventing some transmission. Obviously, trying to avoid physical contact. We shouldn't be shaking hands and those sort of things with each other. But unfortunately, we do need to maintain that distance from each other and work out different ways of greeting each other. So that physical contact should be avoided. Scheduling meetings where possible using video or phone conferencing like Zoom. I know we've all been getting fairly used to that, and as an industry, I think we've responded quite well. But where we can get away with not having a physical meeting, we should try and do those things. And if we've got to have a meeting, we should try and have that outdoors rather than in an indoor environment. Our pre-starts, they should also be conducted outside if we can, making sure everyone's 1.5 metres apart from each other. We should look at our furniture within, whether it's inside or outside, and making sure that it is actually set up already, so to encourage that 1.5 metre spacing and distancing. We should eliminate that interaction with those that might visit our site, whether that be suppliers or delivery drivers, having that contactless delivery service or engagement with those people. I know a lot of sites have already put that into play with a lot of things, removing the requirement for signatures, for example, or signing in and out of a site. It's done through one person, so you're maintaining that distance from each other. So those sort of things are important. Reducing non-essential visitors. So if you don't need to have people visiting your site, encourage them to talk to you or use those other mediums, like I said before, whether it be telephone or video conferencing. And making sure that our site inductions, if we do have people on our site, whether it be workers or other people, that we are actually including COVID-19 and the management measures that we're undertaking onto our inductions for those people. And one of the sections in the assessment tool, the IQA is put together, is around what to do around our vehicles and machinery. These are the areas that we are using, and often more than one person may be using these pieces of equipment. So it's important that we think about the health and hygiene on those pieces of plant. So making sure that they're clean between operators using them, if they are having separate operators. I mean, obviously where possible, if we can have one operator per machine, that's an ideal situation, but it's not always possible to do that. Providing hand sanitizer and cleaning materials and making them available for operators. One person per vehicle, so making sure we're not sharing vehicles. We're not going up from maybe the lunch room or the crib room up to the to the face or the pit. We're not taking several people in a vehicle with us. We're going up individually where possible. And we're not hot seating. So again, trying to limit the amount of people that are using machines. The normal practice would be, of course, where we're trying to maintain efficiency and production, we might have someone swap over and get into a loader, for example, to continue loading. Trucks, where possible though, we should stop that hot seating arrangement. Again, communication between operators should be done via two-way radio rather than close face-to-face contact. As I said before, carpooling, whether it be off or on site, should be avoided where possible. Travelling, singularly in a vehicle. Workers and suppliers who are on site, obviously who display symptoms, should be isolated and removed from site. And it's really important that from a communication perspective, we do communicate that people should stay at home. So if they're unwell or they have any symptoms, then they should not attend work or not turn up to our workplaces, whether that be at the quarry or at our suppliers' workplaces. We shouldn't be attending to those if we're not well. We should be encouraged to seek medical advice or treatment as well. So it is important, and I see that most of the regulatory authorities now, the health departments, have opened up the screening for COVID-19. So it's important that if they do have symptoms, that they go and get tested and get further advice. We should record our meetings and training and other communications that we have to our workers on what is expected. Make sure that's disseminated amongst our people on site. And those that are high risk or have other medical conditions which may be impacted by COVID-19, we should actually consider them and implement appropriate controls, which may include changing the work or their tasks that they undertake to reduce that risk. We should increase the availability of hand sanitizer and disinfectant wipes. train in the use of those and disinfecting surfaces. And we should make sure that people aren't sharing items as well, whether that be PPE or food or drink within the workplace. You may consider increasing the cleaning schedule, and certainly we'll talk about if there was a positive case that should be undertaken. Our staff should be encouraged to get the flu vaccine. I know there are a lot of businesses that do provide that to their employees. Our first aid officers should be trained in COVID-19 risks and management. And I know there are a few courses out there that are providing certification in terms of wearing the appropriate PPE and having to have that interaction with others. We obviously need to make that PPE available to our workers and support them not only from that physical sense, but also from a mental health and well-being perspective as well. As I said, there are a lot of people that are anxious about COVID-19 and the effect on them and their families and their employment. So it's important that we do consider the mental well-being of everyone and our workers through the pandemic. So there are many businesses, not too many quarries, of course, are working from home, but a lot of their support staff and management staff are working from home. Again, as I am delivering this webinar, so it's important that we think about the impacts of that from an option perspective. We should be encouraged to work from home if we're able to. We should schedule some supervision and support, so it's important that we stay connected with each other. We're not in a location where we can have that regular contact, which is important for a lot of people. Some people really enjoy working from home and are really efficient, but others may struggle, being isolated from their workmates and that normal work environment. So we should really consider that. Make sure from a human resources perspective, we have the right policies in place, and that might be as simple as making sure that we've got something written and some procedures around working from home, ensuring that the right workstations are available for them. So we're not creating other risks that we wouldn't normally have in the workplace because they're working in an area that they're not normally working within. We might need to review our insurance policies and make sure they're appropriate for our people working from home, and just making sure that there's communication in place for everyone, whether there's some working from their normal place of work and some working from home. Travel is one thing that obviously there's a lot of restrictions on travel between the states at the moment, but making sure that we are complying with those. Some of your workers may be classed as essential workers, but making sure we understand what the requirements are there, and if they are travelling for work as an essential worker, that we do provide them some level of authority to make that process a little easier. So maybe a letter from the business to say what the piece of work is that they're doing, and they're authorised to travel, particularly across borders, for that work. And in terms of customers and community, as I said earlier on, trying to make that interaction contactless. That's particularly relevant for payment methods, and also trying to avoid or not to encourage members of the public from visiting our sites. Obviously, we want to make sure that we're doing the right thing by our communities that live in very close proximity to our operations, but we want to make sure that we are discouraging those people that don't normally or need to come to our site, discouraging them from attending. Okay, I'm going to hand over to Kylie now, and as Lisa said, we're very lucky to have Kylie being able to participate in this webinar as well, having worked on the front line in the COVID department. So this is very relevant to Kylie's area of expertise, so I'll hand over to Kylie.
Great, thanks, Clayton. So you may be wondering what you can do yourselves from an infection prevention point of view. So there are a couple of things I'm going to talk through now about some handy tips that you can use. If you're a person that likes to get changed in and out of your uniform at work, just remember to bring a plastic bag to carry those items home in your car. When you are getting ready for work, prepare for the day by limiting the things that you need to bring to work. So don't go carrying lots of extra items that you aren't going to need, basically. And don't forget to swipe down your personal items when you arrive at work and when you're leaving, such as your phone or your ID badge. I do know some people that have gone the extra step of actually placing their phone in a sealed plastic bag to use while they are at work. That's a personal decision that you can choose to do as well. When you are travelling to and from work, it's important to maintain the physical distancing of 1.5 metres apart, particularly if you are using public transport. If you are using public transport, sit or stand with your back to people so that you're not facing directly, face-to-face contact. And when you arrive at work, make sure you clean your hands with soap and water, or if you don't have access to soap and water, use an alcohol-based hand gel. Make sure you practice good hygiene. Clean your hands regularly during the day and avoid touching your face. We all have heard that through all our state health departments. Regularly wipe down frequently touched surfaces within your workspace. And if possible, use your body or elbow to open doors, not your hands. And also using your feet to keep doors open as you try and get through doors if you need to, if you're carrying items. With regards to your breaks, avoid eating in communal areas. If you do need to eat in communal areas, making sure that you maintain that physical distancing of 1.5 metres. And if you do bring your own lunch to work, try and bring it in a reusable container and make sure that you wash it afterwards. And at the end of the shift, clean your hands, particularly your forearms, up to your elbows, with soap and water, and make sure you wipe down your phone and other personal essential items with you, like your ID card. And when you arrive home, it's a good idea to take your shoes off outside before you go inside your house. Take a bath or a shower when you get home. Wash your uniform as if you would normally, or your work clothes as if you would normally do on a usual wash cycle with some laundry detergent. And it's also important to make sure you wash your hair regularly and trim your nails regularly as well, just to minimise that infection. And this slide now talks about how to hand wash and how to hand rub. So it's important when you are using hand wash to use it with soap and water, that you make sure that you rub your hands palm to palm, that you're interlocking between your fingers, and making sure that you're scrubbing underneath your nails as well and not forgetting your thumb areas, and making sure that it's all washed off with water and that you dry your hands thoroughly after use. It's also another good idea if you're exiting a toilet area to put some paper towel around your hand to sort of touch the door to open it, or again, use your elbow or something like that if you can. Hand rub, similar idea, making sure that you place enough hand gel onto your hands, rubbing it together and interlocking your fingers, your fingernails, and also your thumbs, and then letting them dry naturally in the air. Simple steps to stop the spread. So you would have seen this in the community that the Australian government's put out. So it's talking about the simple things that we normally do during flu season that's promoted. So cough or sneeze into your arm. If you do need to cough or sneeze or blow your nose, make sure you use a tissue and bin the tissue straight after use, and make sure that you wash your hands as well. Keeping your distance. This is another one that you would have seen the Australian government have in a lot of community areas. It's about talking about that 1.5 metre physical distance. Remembering, don't shake hands or exchange physical greetings with people, and wherever possible, you need to stay 1.5 metres apart and practice a good hand hygiene. So some hygiene guidelines in the quarry industry, particularly around plants, vehicles and equipment. It's important to clean all common areas before and after use. Common areas would include things like your steering wheel, your gear stick, your handbrake, your door handles, the interior and exterior of the door handles, your seat belts, your seats, the seatbelt buckles as well, your radio, air conditioner, dials, glove box, cup holders, rear vision mirror, indicator arm, and windscreen wiper arm. Those commonly touched items within the plan itself. Clean it with cleaning wipes or a hospital grade non-bleach disinfectant solution is ideal, and make sure that you wash your hands after cleaning those items with soap and water. And if you don't have soap and water available, use an alcohol-based hand sanitizer. If you do become aware that a person's been diagnosed with COVID-19 and they've recently driven or been a passenger in plant or vehicles, make sure you isolate that plant or vehicle, report it to the supervisor, And then look at hiring a professional cleaner to clean that item of plant or vehicle. So what does routine cleaning involve? It basically just maintaining that daily cleaning task of the work environment as per the usual practice, ideally using a hospital grade disinfectant solution, but also a detergent is also ideal with some warm soapy water. Making sure that you look at those frequently touched surfaces like doorknobs, tabletops, light switches and phones. COVID-19 likes to sort of stay on horizontal surfaces such as furniture and equipment. So those are areas that you need to look at, as well as monitors, desks, any tools that you're using within the quarry, keyboards, bathrooms, meal rooms and shared facilities. What should you do if you're at work and you start to develop symptoms? So those would be if a person becomes ill with respiratory type symptoms at work with or without a fever, we need to isolate those people by placing them in a room or an area away from others. Arrange for that person to be sent home or access medical assistance. And if a worker is confirmed to have COVID-19, we need to call our relevant state health department for the current advice. If workers have come into contact with a person who's been confirmed about the potential, we need to notify them about potential exposure, but we also need to maintain confidentiality and advise the workers that if they do develop respiratory symptoms and or a fever, that they need to seek medical advice immediately. And it's also important to clean the area where that person was working and all the areas where they have been. So this slide here is put out by Safe Work Australia. It talks about what to do if there's a suspected or confirmed case at work. So the things that I've spoken about in terms of isolating, if you do have access to a mask, then, a surgical mask, then the person can place on a surgical mask. Inform, you need to notify the COVID-19 hotline, that's a 1-800 number, organising transport for that person home, cleaning the work areas where they've been, identifying who may have come into contact with them, cleaning the area again where they've been in close contact, those contact people, and then going through and reviewing your risk management procedures. If the suspected or confirmed case is not at work, again, it's about informing, identifying, cleaning, and then reviewing our processes as well. I'm going to hand back over to Clayton now to talk about the next steps.
Thank you, Kylie. So as I mentioned earlier on, some of the states are already starting to relax some of the restrictions, although I think we're a little way away from situation normal as we used to know it. But one thing that we need to start thinking about is what is going to actually happen when the restrictions start to get lifted. So we're getting used to life in some form of isolation, and particularly from a home environment. But it's important that we understand and we think about that coming out the other side through the various stages of lifting these restrictions till we get back to some level of normality. The first thing we should do is update our risk assessment. So we've done a risk assessment, hopefully at the start, as we talked about earlier, and that might be part of our business plan, could also be sitting separately in our safety and health management system or a risk register, etc. So we should update that. Again, thinking about the hazard and what controls we're putting in place to assist in making sure we don't get exposure or we can manage that hazard. We should carry out adaptations to the layout of the workplace, and really I think from this perspective we talked a bit about furniture before and making sure that was 1.5 metres apart from each other, thinking about where our workers congregate and thinking about where they work. So really thinking about that as people return to work. And you may consider, if you've had some of you people working from home or all of you people working from home, maybe not bringing them all back at the same time, particularly if our offices are small and we don't have that ability to physically distance from each other. So we need to think about, again, who's working maybe more efficiently at home, who's happy working from home, and then who actually needs to be back in the office. That may be one first step that you take in terms of progressively bringing people back to the office as we sort of consider that risk and as it reduces and as these restrictions lift. So that was my next point. So yeah, providing them with some training as well as they come back in stages. So we need to continually provide them information, making sure that they are informed about what it is that they need to do, what's expected of them, but also how they are to resume work. So things may be a little different from when maybe they were told to go and work from home. So when we bring them back, they just need to be aware of what's expected from them there. We need to provide some support. And again, I mentioned earlier, some people may be experiencing some level of anxiety or stress around COVID-19, even more so maybe when they come back to the work environment, because maybe they've been isolating quite happily in their home environment with their family or on their own. When they come back and be in the presence of other people, that may cause some anxiety or stress. So we need to think about that and how we can manage that and support our workers through that process. Might be simply by talking about it, providing some other external assistance, butting up through with other colleagues. Might be about changing our work in terms of the organisation of our work or the work tasks that we do. And if we've got an EAP in place, an employee assistance program, maybe providing that and that ability to access that for our workers. So as I said, they may not want to return to work as well if they're really concerned. So it's about understanding that concern and providing further information to them and support so they do feel comfortable coming back into the workplace. So we need to plan for the future. We're all looking forward, I'm sure, to getting back to some level of normality in society and getting out of these restrictions. So we need to plan for that, and we can use that business plan and that COVID response plan to do that. Much like we talked about coming out for the workplace, really starting to think about documenting that from coming back from these shutdown or restriction requirements back out to some level of normality, although it may not look exactly the same depending on what our business looks like. So really planning for that and documenting that in that management plan, so we know what steps we're going to be taking. We may have implemented working from home measures, so we just need to make sure that we put that in the plan as well and work out how we're going to adopt that. But there may be some things that we've really learned from. I've already heard a few stories from some businesses about changing their work environments and even changing shifts cycles and those sort of things that they've learned from people working from home, and how people are more efficiently working in a remote capacity, or maybe that suits their work-life balance a little bit better. And so those things we may actually want to continue. There may be some real positives out of the COVID-19 pandemic that we want to continue to do. So those things should actually be thought about and planned for. And if there are positive things, then we should be reviewing those and looking at those as part of our ongoing work environment. We need to stay well informed, as we talked before, stay in touch with the information that's being provided not only by the federal government but our state health authorities. And even as Collie showed before, there's information there from Safe Work Australia and other organisations that we can utilise as we return to work and come out of these restrictions. So, of course, to begin with, we're going to have to continue to physically distance ourselves, but those things may start to get relaxed. But we've got to understand whether that applies to us and our business as well. So some industries may be allowed to come back and have more contact than others, depending on the type of business that they have. So we just need to be understanding of that and stay in touch with the information that's provided about what is required of us and our business. As I mentioned before, in that assessment tool provided by the Institute of Quarrying, there's quite a few links there, depending on which state or territory you're in. So I'd encourage you to click on those links through the assessment tool, which again, it's provided on the IQA's website, to get some further information around COVID-19, those updates, and about how to deal with that for our employees and for our business. This is just the usual slide. So whilst the IQA and Kylie and myself have endeavoured to make sure that the information is up to date and relevant, we obviously encourage you to make sure that you confirm that information if you're going to rely upon it for your business, confirming its accuracy and currency. So just a little disclaimer there from the IQA. As I said before, further resources and that assessment tool that I mentioned is available on the IQA's website, www.quarry.com.au. And Collie and I are certainly available to answer any questions after this webinar. Should you want to get in touch, you can do that through the Institute of Quarrying. Our details will be available through the IQA. So I'll hand back over to Lisa now.
Thanks, Clayton. And thank you to yourself and Kylie for taking the time to provide this information. Certainly very good information and advice, and with Kylie's experience on the front line, some really handy tips that people can take to help themselves now, but also going forward. So thank you again, and we will say goodbye at this point, and have a good afternoon.